Hi, this is Tom at the University of Iowa. I'm going to show you an iris sutured case. But first, I just want to show you some cool drawings from Alton Chizetto, who's a friend of mine. Here you can see what we're going to do is prolapse the optic anterior to the iris. And now we can see where we have to suture, in this case a proline suture, just under the haptic. So through the iris and under the haptic. And now what we're going to do is we're going to take out both the free end through a paracentesis and also take a loop out through a paracentesis. We're going to wrap that loop around forceps, grab the free end, form a knot, pull the knot inside the eye by pulling on both sides. So that's a classic sliding knot technique. So here's the case. You can see it's a multifocal lens that's in the sulcus and out of position. We're going to place two paracenteses at first. Eventually we'll place a third. We're going to use a Kugeln hook in this case to get the lens centered. We want to have these sutures typically at 3 and 9 because in case there's some ovalization, it's not as annoying if it's in that position. Here we're going to use some myocol. We're going to lift up on the optic and we're going to try to get the optic captured by the pupil. Here we're using this long curved needle on the 9.0 proline. We're going through the cornea, through the iris, just under the haptic. You can see it there, and then coming out anywhere. You want to go towards the curve of the haptic. It's just easier to do this pass. So this one's going to be backhanded across from us. So now here's the suturing technique. We're going to have to pull that free end so that it's all the way through. We're going to cut off the needle, and we're going to pull it through this paracentesis so we know that that free end is through the paracentesis. And now we're going to go in and we're going to reach through and grab a loop on the other side of the iris pass and get it all set up. We want to make sure that the free loose end is in the middle. The iris one is on the left. We're going to wrap the iris side of the loop around 3 times, grab the free end, pull it through. The knot's beginning to form. Keep the tension even as you pull it. And so there's a nice even tension. Now we're going to do it 2 more times. Typically go 3-1-1 or sometimes 3-2-1. Always the same setup. You can see we're going around here, grabbing that free end. We've got a little help from Dr. Trevine, pulling it through. And keep the tension even so that the IOL doesn't move very much. Now here's the last pass. We're going to go through the Kugeln hook and pull it through the paracentesis. Get it in perfect position. In this case, it's much better position for the grab. You can see I've got it really teed up nicely for the grab. Pulling it through, both ends, even tension. And so we've got a nice knot right there between the haptic and the iris. We're going to cut it off with some micro scissors. Do the same thing on the other side, of course. Now we're going to push the optic posterior. It's a real moment of truth. Hopefully it's going to work. We're going to search around for any vitreous that may have come forward. We didn't expect that. We're going to use some sealant here. Patient's done really well. This is Tom at the University of Iowa. Thank you very much.